Okay, welcome to Caruso Physical Therapy and Nutrition. Family owned and operated. My husband is the doctor of physical therapy. I'm a registered dietitian. And we have our amazing dietitian, Michelle.
Hi, guys.
So Joe's a doctor of physical therapy. He undergrad was in kinesiology. I have a RDM. Michelle and I are both RDN, so which is a registered dietitian nutritionist. I also have my master's in nutrition education. And I'm no longer treating patients, and Michelle is seeing all the patients. Obviously do physical therapy, nutrition, and then we offer Pilates reformer as here as well. And we accept insurance for both PT and RD for services. I'm going to turn it over to Michelle to talk about the FODMAP.
All right, guys. So the FODMAP elimination diet, how to manage your GI system. So I like this funny saying, don't let your pain in the gut be a pain in the butt. So just to introduce this, all of this research is taken from the Monash University and King's College in London. So they are the originators of this whole program. So just to introduce me really briefly, I know all this stuff is written up here, but I am a registered dietitian. I went to school in Scranton at Marywood University, but I'm also a fitness professional with like 100 different credentials. So basically just very health-minded and fitness-minded too. So some statistics of IBS, just a little bit of interesting facts here. 10% of doctor visits and between 20 to 50% of gastroenterologist visits relate to IBS. That's an incredible number, and especially when there's not really any cure for IBS. That's what I love about this FODMAP program. That way we're able to actually address these needs for 50% of these people. It's crazy. IBS is the second most common cause of absenteeism in Australia. People with IBS have 50% higher medical costs than the general population. And again, to say this medicine is not curing anything, it's just alleviating symptoms. So how great would it be to do that through food and not through medicine, right? And the quality of life of IBS sufferers are equivalent to those with chronic kidney disease. So not that you have to reveal your symptoms to all of you here, because again, I don't want to make you feel uncomfortable, but I know for me personally, I do have colitis, so with my symptoms, it's almost like debilitating. Like I have to constantly hide them, and at least I work in an environment that I don't necessarily have to do that. But with patients, to hold that in, it's so hard. It's this uncomfortable pain that comes up, and it literally feels like you can't move. I don't know, you can just nod your heads if you've experienced that, to the point where you feel flushed, you feel like you can't breathe. It's this pain here, pain goes to the bottom of the gut. So, oh my gosh, I would like to help you relieve those symptoms to improve your quality of life. So a little bit about my story with these FODMAPs. So they weren't as popular back in my day when I was first diagnosed with all of this stuff. And the originality of all of this in my life, it was when I was like 20 years old. I was in college. I had like an ear infection from my cartilage piercing, and my doctor gave me a medicine to get rid of that infection, but that led to an allergic reaction. So then he shipped me over another antibiotic, very strong antibiotic, which then led me to experience some symptoms that were completely abnormal. I was bleeding, I had bloating, gas, going to the bathroom like 8 times a day. I was going to doctors, nurses. Everyone was sending me away saying, oh, it's just hemorrhoids, like use Vaseline, or oh, use Imodium, that'll like help relieve that. So no one was listening to me, and it got to the point, I'll never forget it. One night I woke up in the middle of the night. I had intense pains throughout my whole stomach. I was bleeding like crazy, and my sister took me to the hospital, and I had to ask for the test in order to get diagnosed with this bacterial infection throughout my entire colon. So if I didn't go, if I wasn't my own health advocate, and that's why I know you guys are here today, you're being your own health advocate, I would never have known what was going on, and that could have led to future surgeries, so many things I can't even imagine. So after that happened, I went on several rounds of antibiotics. I had double reoccurrences. I missed about a month of school, if not more, and the doctor finally told me after all of this, he diagnosed me with colitis, non-specific, but basically he's like, here you go. Here's some papers. Go follow this elimination diet. Bye. So that's what I was left with. And I was 20 years old living in a dorm room. Like, what was I supposed to do? So with that being said, I've learned from this. I know what it feels like to feel like an outsider, to feel like the only person who can't eat anything and not know what was going to happen, to feel like your social life's affected. So I created this program so I could help you guys and help you not feel like that. So FODMAP, what is it, right? Who has heard of it before? Raise your hand. Okay, good. So these big words here, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, all they mean is that they don't digest well. They're poorly absorbed. They take in water into the intestines, and ultimately they ferment in the gut. So this is a very common thing. This is going to happen whether you have IBS or colitis or whether you do not. It's just with people with these chronic conditions, we're affected a lot more, right? So that's why it's important that we address this. This just explains further what these big words mean and just defines them a little more. There are different types of carbohydrates. The oligosaccharides are single, disaccharides mean 2, mono means 1, oligosaccharides are few, excuse me, and then polyols are sugar alcohols, so that's usually anything that contains artificial sweeteners, but I like to say anything with like the OL to make it a little simpler for you guys. I'm sure your head's spinning a little bit right now. A lot of information, but don't worry, when you do go on this program, you're gonna have everything you need spelled out for you, okay? This is just the introduction. But this just explains it in a little more detail. Some common ones that people fail to realize, fructans in wheat, but onions and garlic, even garlic powders, garlic salt. I learned, he's smiling, I learned that the hard way when I started this out, because I do this regularly just to see, I don't know, if any other symptoms, if I can still introduce other foods, because this is an ongoing process. Disaccharides, anything with lactose, basically, milk sugar. Monosaccharides, important to note, people think they can't eat fruit. This is what I thought, this is what I was originally told. That's not true. Every fruit has a different level of what we call fructose, but especially with fruits, certain fruits have glucose and fructose, which helps balance it out, so that way we're able to absorb it more easily. So again, you'll get that whole list. Off the top of my head, bananas, strawberries are usually okay. And then polyols are sugar alcohols. It's usually found in your gum, but also found in some fruits, cherries, nectarines, apples, and even some vegetables like cauliflower, which is a common substitution nowadays. I love this picture. We were talking about this just because it shows how it is created in the gut. The FODMAPs, how they are digested, and what they produce is unhealthy bacteria and healthy bacteria, which we need the balance of both. They're both very important, but then it also creates, they call it wind, it's flatulence. And with people that struggle with FODMAPs, we get excessive. So our symptoms vary, whether, and you can raise your hand if you want to share some symptoms, whether it's heartburn, chest pain that feels like a heart attack, diarrhea, bloating, gas. I just like that. I thought that was a funny picture. Okay, so who should give this a try? People with IBS, other gastro disorders, any bacterial growth, and even something that I learned new researching into this, rheumatoid arthritis, fibromyalgia, and then even frequent migraines, which I think is kind of interesting. So if any of these symptoms like appeal to you while you're watching this, maybe this is something that to give a try. So this is sourced from ibsfree.net. I do want you to raise your hand for this. This is the, and again, this is not showing over, the film. But just raise your hand if you experience these questions. Do you have digestive symptoms such as excess gas, bloating, abdominal pain, diarrhea, and constipation frequently? Have you been properly evaluated by a healthcare professional and diagnosed with any other conditions? Okay, so if you haven't been diagnosed, what I am going to reiterate, not sure if I said this at the beginning of the presentation, is that before we begin any program like this, you need to go to the doctor, get properly diagnosed, make sure you check into everything because something could be going on like celiac disease, cancer, that is a lot more imperative to treat, and we can't treat it with the FODMAP.
And just to explain it a little bit more, the reason why Michelle wouldn't want you to start on the program if you haven't been diagnosed, because some tests you need to still have that food in your diet. For example, for celiac disease, let's say you took gluten out and then you went and got tested, well, you could get a false negative. So the only way you would get a positive if you really couldn't tolerate it or had celiac is if it was still in your diet. So that's why it's important not to do any elimination before you get a diagnosis from the doctor.
And then has your doctor or dietitian recommended FODMAP? Has celiac disease been ruled out? Have you been unable to manage your symptoms with good health habits like regular meals, managing stress, and getting adequate amounts of fiber, fluids, and exercise? So that's one thing I actually do want to touch on for a brief moment. With this program, I'm talking about like intense pain, like excessive gas, maybe every other day diarrhea. So it's normal to feel those symptoms, maybe every once in a while getting diarrhea, bloating, gas, but if it's chronic, that's when we need to assess our habits. And then if it continues further after we've done all that, that's when we try this out. Are you physically, mentally, and emotionally able to limit your diet for a period of time without endangering your health? That's also important to note because this is hard to do. You're going to feel restricted. You might even get frustrated, but with the proper support, it's definitely doable, definitely manageable. And I've been through this, guys, so I can definitely help you out there.
And then also, just real quick, the other thing is that this isn't forever, as we briefly talked about before. Doing this elimination is not forever. The thought is that you're going into it to figure out what is the culprit, what is the problem for you, so then you can take out that one issue or 2, 3, however many you have, instead of everything.
And then, are you willing to take on a dietary experiment? So we already talked about this. Consult your doctor about these problems. It could be something more serious. How it works. So typically, it's usually ranging from 6 to 8 weeks. Honestly, though, it depends on you. So for me, when I first did this, it was 8 weeks. Now when I do it to see if my stomach is ready to introduce other foods, it only takes like a couple weeks, if not 1 week. It's just until the symptoms are completely gone, then we can start that reintroduction process.
And I always like to explain it as if anybody has had children. You know, remember, we always had to introduce one food at a time to make sure there was no problem. So anybody that's a parent, this will ring home to you. So the point is to see, is there any issues with this one food? And remember, when you did it for a child, you wanted to know exactly what that one food that was a problem, if there was a problem.
And then also reintroduction is important. A lot of people feel that like, oh gosh, I'm so afraid to add these foods in because I don't know what's going to cause it. I just don't want to feel that pain anymore. I feel so great without all these foods. Well, it's actually super important to add them back in because if we don't, we're cutting out really important nutrients like prebiotics, fiber, minerals, calcium, protein, essential for your health. So that's why we shouldn't completely cut things out. We do need to test it out. And dietitians, that's us, can help with this. So no worries, we got you. This is a low FODMAP, not a no FODMAP. So as I just explained, doesn't mean we cut it all out. It's just let's take it to a low level, and that includes portion sizes as well. And this is highly individualized. So I might tell you, oh, I can't tolerate dairy. I can't do some fruits. I can't do apples. I can't do chickpeas. But that doesn't mean you can't, so don't be scared. Everyone has different limitations. This just depicts the 3 phases, just a little more simplified. We start with that restriction, which is between 6 to 8 weeks, usually, and then we start reintroducing these foods. And there's a very structured process with that, so we do have to make sure we do that completely accurately. Just like, say, going for a blood test and getting a diagnosis, how you have to fast. Same thing applies here. This is literally the only way we can test this. We can't do it through blood work. We can't do it through any other way. So it's important to keep that structure. And then we have long-term management. Yay! So, of course, more long-term research is required as evidenced in 2 recent studies. However, what this really says is that we will eventually be able to reintroduce these high FODMAP foods, but it's based on your personal tolerance. So research is needed, but a lot of times this research gets a little misconstrued because people don't follow the elimination process accurately. That's what they've really only found to happen. And we've went through this already. It's important not to completely eliminate them, but there are certain criteria, and we will guide you through that. So what it involves, there are typically about 10 main re-challenges. I know that sounds scary, but again, it's all going to be spelled out on a paper. You have nothing to worry about in chart form. And each of these foods, which are the FODMAPs, it's going to be a 3-day introduction. So we do 3 days with that specific group, and then we take it out for 3 days. We write down signs, we write down symptoms. Food journaling is essential with this process. And the portion sizes are so important too. So just like with healthy living, if we go past, say, a half a cup with a low FODMAP food that's supposed to be low FODMAP, if you do a cup, chances are it's going to act as a high FODMAP and it's going to mess up the testing. So it's important to note that as well. And that's just the reference. And make sure the re-challenge of the food contains only one type of FODMAP. So that's where it can get a little confusing, where certain fruits, like you saw it before, cherries, they contain xylitol, the OL, but they also have fructose in it. So that's super confusing. So we just have to follow along with what we're given. And that's just an example of each of these. So literally spelled out for you, which is fabulous. And we'll go through that list, but everyone has a different level. You notice how sometimes fructin is repeated. That just means it has different levels of fructin, so it's allowing you to test that certain thing to see if you have to eliminate it. So ultimately, at the end of all of this great deal, you'll have a better awareness of what foods exacerbate your symptoms and how much you can consume. So will you die if you eat these foods? No, it's not a food allergy. Studies have shown that when we do consume these foods that we've identified as high FODMAP and not tolerable to us, we're not going to develop any disease. We're not going to develop anything. But those studies are actually still ongoing from what I've read. So I would say the best bet, if you're in pain, like, why do it to yourself? Why cause unnecessary inflammation in your body and lower your immunity? And this is important to determine in order to manage IBS symptoms. So one thing I did want to point out, you should always consult a registered dietitian, because with this program, you could end up with nutritional deficiencies. I know it happened to me. So let's avoid that. And even if we could do one-on-one sessions, but you will have consultation with us throughout. But if you do live in the area, I do strongly recommend get your benefits checked, and then we can go from there. All right, so overall, the more FODMAPs consumed, the more likely symptoms will occur. So even if you're having low FODMAPs throughout the day, or you have, say, 2 high FODMAPs, and you get stomach issues, chances are it's just too many. It's not that you have to avoid the foods completely. So we just have to monitor that and what triggers you to your individual level. I already explained the no testing is involved with this, but all of this and even the curriculum we developed is based on information from the Monash University and from King's College in London. So it's all credible information of these originating sources. So what we have to offer you, this is the fun part. So course materials and recommended apps we will give to you. We already did the research, make it easy for you, because we know in the nutrition world there's a lot of interesting things that exist that are not accurate. So we do the work for you. You can trust us with that. You have access to the dietitian who has been through this journey. So what I'm recommending to you guys, I've done it myself. Like, I'm very passionate about helping you because I know what it feels like to be in this. So no worries, you'll have someone who understands. And a Facebook group to be involved with as a support group, motivational texts. We will do insurance verification for you, and you'll get recipes, tips, and ultimately just get through this whole process with support, because we know how hard this is, or we wouldn't be watching this video. And my closing point to all of this, whether you go with me, anyone else, a dietitian is so important to consult, because we shouldn't follow with a nutritionist, dietitian. We are the nutrition experts in our field. We're the only ones that are properly credentialed to address with this. So please, even if you're out of the area and you need to see a dietitian, find a registered dietitian. And then that's the references. Does anyone have any questions?
So I guess when you say, like, if, I'm gonna like give an example, like, I feel, I get depressed because I feel like sometimes when I eat healthy